So today we received notification from the state of Colorado at about 8 o'clock this morning that we have our first positive case for the coronavirus, COVID-19. In the state of Colorado, when a test is positive, that means it's considered presumptive until validated by the CDC, but we're treating all presumptive cases as positive cases. The individual is a male in his 30s, and that's all I can talk about as far as the individual goes, simply because we don't want to give any information that would track this person back to a specific location. So from that, go ahead and ask me questions.
Can you speak to whether or not he's traveling?
No, and that's a great question, and I'm sorry I didn't address that. So the contact was, so it's a local individual who was visited by foreign travelers. So that's where that came from. So as with most of the cases in the state, it is the foreign travel piece that is the connection there.
Can you speak to his condition?
Condition is actually healed completely through it. So you know, and that's good information, because oftentimes we don't know what will come of these individuals. So he has already gone through the process and is past the symptomatic stage.
Has there been any testing of people he may have been in contact with while he was contagious?
So that the process for this, so public health has been responsible for being the resource to local partners, issuing guidance, and all the guidance either comes from the CDC and from the state of Colorado. And so now our role expands. So as soon as we have a case, we do a case investigation and then follow up with all contacts. And that has started to happen as of this morning. And so the magnitude of the contacts, we don't know yet, but that's our role now. And as other positives come up in the county, which they will, then we will continue to go through that process.
So how do you do that? I mean, did he go to the store, a restaurant? How close do you have to be? How do you know if he's impacted?
Well, so the guidance is close continued exposure. So that means within that 6-foot radius, and then for a consistent amount of time, or a continued amount of time. So, it's a judgment call for the most part, but at least if we follow that guidance, because we don't want to go overboard with this. And there may be some instances where there was a place visited where we may just simply have to send out a notice to folks and say, if you were in this place at this time, you may have been exposed. So some of our guidance will be to individuals that did come in close contact. It would be to quarantine themselves. And then if it was people that were at that place at that time, it would be to just be on the lookout as symptoms may arise. So yeah, it gets a little technical, but that's the best we can do right now. And honestly, I think the biggest impact will be those close contacts. That's where we know there's going to be some potential.
And where does he live in Mesa County?
I can't say that.
Okay. How many test kits does the health department have?
I don't know. How many test kits do we have right now?
Around 100, and we continue to get more.
Okay, so we have 100 test kits and we continue to get more. As of Tuesday, we are going to start a drive-through test clinic off campus. Location to be determined and announced as we get closer to that time. But that's going to be a collaborative effort with the hospitals, local healthcare providers, and public health.
How did he find out he had it? How did he know? Tested or whatever?
The visitor became ill, was tested positive, so then as symptoms arose, then the next cue was to get tested as well.
Okay, so did he return home, the visitor? Did the visitor return home and then?
Yes, the visitor returned home, tested positive, and then made our person aware. Yep, that's right.
So it was someone visiting him?
That's correct, yes.
But he did not, just to clarify, he didn't do any traveling?
Nope,
Okay.
was visited by someone from another country.
Okay. Which country?
I don't think I should say that. No, I'm not going to say that.
Could you
reiterate where these tests are available? Like if a person is concerned, what should they be doing?
So the process is if someone's concerned, and first off, if someone, we don't want people that we don't want the worried well, because we don't have the capacity to serve a lot of people. So we are asking people to go through a screening process. So first they should call their primary care provider, and then if they don't have a primary care provider, they should go to our website and get the number for Mesa County Public Health. And what we'll do is we'll put them through a series of 4 questions to determine risk. Because if there's been no exposure based off of what we know as the commonalities, then there's no reason for the test at this time. So we're really not inviting anyone in that has a suspicion to come and get tested, because we would be overwhelmed. And with 100 plus or so kits, we wouldn't have the capacity to do that. So,
How many test kits have been used?
that's a good question.
We only have numbers at the state level,
Okay.
around 600, and that's changing consistently.
Okay. So yeah, locally we're not sure because the hospitals are testing right now. There are some primary care offices that are testing, and so as far as how many have been done here, we were getting reports daily on number of tests locally, but then that went away. As a state, we've conducted over 600 tests.
Now that we have a case in town, is that screening process set to change? Because there could be that person-to-person contact that we've seen over in the front range.
Well, as far as when it becomes person-to-person contact, then the screening no longer is about those 4 questions. It's about association to the case in question. So that the screening process is slightly different. So to test someone that's associated, we would not put them through those same questions. We know that there's an exposure and the need for that test.
How long was it between this visitor leaving and this gentleman deciding to go get tested?
I don't know that. I don't know that duration between when they were exposed and when they got tested, I think is what we're trying to figure out. So.
And was he tested by you guys?
No, tested by one of our partners locally. Yep.
And was he tested because he was sick or because he was exposed?
Tested because he had symptoms. Because one of those questions is if you don't have symptoms with travel, then really what we're asking people to do is you may be at risk, monitor yourself. So that's even.
Self-quarantine and.
That's correct. Yep. So.
Was he notified this morning as well?
No. Well, he's been aware that the test was submitted, so it wasn't that the first that this person has heard about it. So has been taking precautions. But yeah, notified of the positive test this morning as well. Yep.
Did he require hospitalization first?
No, and fairly mild symptoms and fairly short duration from what I understand.
So he was just in isolation at home the whole time?
That's correct.
So no hospitalization?
Nope. Mm-mm.
Does the health department want to make any further recommendations to the community as of right now because we have this presumptive positive?
I do want to make some recommendations. So in Mesa County, because I don't want this to generate fear, and so I know that let's consider that what we're hearing worldwide, nationally, and even in the state to a certain extent, it is generating a lot of fear. But we in Mesa County, our population is isolated, and so, I think if we're diligent about doing things personally and also from a group perspective, knowing, how do we socially distance ourselves either at work or out in the community, if we move forward with those precautions, we can do a great job with this. And I've seen other countries, Hong Kong is a really good example. By implementing certain precautions, they have really leveled the spread of this. Now they have different rules and things there, but we know that if we enact certain precautions in our community, which is isolated, as I said, we can really impact this thing. So I don't want people to fear this, and certainly we can say, and I don't want people to say, well, the conditions are mild and I'm not in a risk case, so I'm okay. Just know that if you become ill, you could come in contact with those at-risk populations, which are people 60 and above or anyone with a compromised immune system with another current disease. That's what it's all about. Let's minimize the high-risk activity with those groups that I mentioned.
Does this case make you cautiously optimistic in that they were mild symptoms and that he is doing well now?
It does make me optimistic because I think the first place we go is the dreaded, oh my gosh, this is so bad. So it's not that bad. It's not that different than what we deal with every year with influenza. But once again, I think the key to our approach is protecting those vulnerable people. What we don't want is a death. That's really, if there's one thing our objective is that we don't want a death in Mesa County. And we have total control over that, so.
And this gentleman's expected to make a recovery, you said it's kind of already working.
Actually, is recovered, would be considered recovered, so 24 to 48 hours after symptoms, so we would consider that recovered.
So that's what I'm curious about. We keep hearing about the 14-day thing.
Mm-hmm.
How does that involve the symptoms and the potential
Yeah.
spread?
So the 14 days is the incubation period. So quarantine is what we ask people to do who have been exposed but are not ill. Isolate is what we ask people to do who are ill. When you quarantine yourself, you're really talking about the incubation period. So if you quarantine yourself for 14 days, then you're past that period. If you have no symptoms by that time, then you're clear. Because the incubation period is that disease festering inside you and eventually showing symptoms. Isolation is if you become sick, then your expiration period is let's be safe and say 48 hours after symptoms have gone away. So it could be much shorter. You could pick that thing up in 5 days. Let's say you have a 4-day period of infectiousness, and in the 5th day, you're 24 or 48 hours afterwards. You're talking about similar time, but it could be shorter, honestly. So.
How long are you contagious and when do you start being contagious and when does that end?
Well, it's obvious that you're contagious with symptoms, because with coughing, and this is really coughing, there could be sneezing, but that's not really called out in this virus. With coughing, the thing is that you're aerosolizing the virus, and so that's where they talk about the 6-foot separation. And so people who are sick, masks do help them because that's containing the cough. That cough can get on surfaces, so that's the spread. As far as prior to, it is possible, if you touched your mouth or something and touched a surface, but we don't know as much about that. The obvious transmission is with those symptoms and with that coughing and aerosolizing and hitting surfaces. So
this gentleman did isolate when he felt symptoms? Or?
yes, yep.
And again, how many test kits does the health department have?
What was it exactly?
Around 100.
About 100 test kits is what we have right now. But we're getting more and more test kits, and I just read something where a new manufacturer was coming about that they were going to make more test kits available. So far in our community, the number of test kits available has not been a barrier to this at all.
And how long does it take for results?
It takes about 24 hours for the state to give us results. As could be imagined, they're getting overwhelmed with tests, and so they're running, if not 24 hours a day, they're running up to around midnight, and then we get called, as I said, I got called this morning from a test that got ran yesterday. So that's the process. When they send it to the CDC, it could be 4 to 6 days, but the CDC really, that result has no bearing on what our actions are.
And it's presumptive positive until the CDC confirms
That's
it?
correct. Presumptive positive and then confirmed once the CDC processes.
And they're the only ones who confirm.
That's correct. Yep.
And the drive-through testing is expected when?
We're going to open up on Tuesday.
And why is that necessary?
Well, we don't want people to walk into, like for example, we had someone that was referred here last week that came into the building and said, I was told to come here to get a test. So, we don't want that to happen. Now, here on our campus, what we're asking people to do is to call us first. We screen them, and then when we ask them to come to test, they drive to the side of our building, and we've got parking spaces reserved. So we're
Kind of the same thing.
It's a drive-through process right now, yep. I think this will more benefit the hospitals because the walk-ins at the hospitals, as you can imagine, is a problem. So if we can, have the hospitals and us working together as a team at this facility, then I think that'll work very well.
What's the, how long is the drive-through testing gonna be? What are the hours?
Well, we're opening it up as 9 to noon right now, but since this is appointment-based, we're going to open up as needed. We'll get more cases, and so I do believe that we're gonna need to test more. But I'll also say, as with influenza, we test for influenza each year as well. When we get to a certain number of cases, we know it's here, so then a clinical diagnosis is all that's needed. So then the recommendation is, it's likely you have this, here's what you need to go do for yourself. So, anything else?
Is there anything else you want to add?
Well, I do want to continue to direct people to our website. We compile everything for the community, and that's health.mesacounty.us. And then we're also doing quite a bit with this on social media on our Facebook page. So in Facebook, just do a search for Mesa County Public Health. And so we're keeping both of those up to date regularly, working hard on doing that. And that sort of prevents misinformation from getting out there. So anything that's valid, we're pulling it in and most up to date. So. Mm-hmm.
One more question. Are you like, it's on the Front Range, it's pretty widespread. Are you concerned about that here right now?
I am. So the stages that this will occur, so first preparation for it with no existing cases, which is what we've done. Next is we have a confirmed positive or a presumptive positive, so that becomes individual trace contacts or contact tracing, I should say. Next stage to this is going to be called sustained community transmission. That's person-to-person transmission from within the community. So that's a whole nother level of communications out to the public and making sure then, because people are a part of a cluster, containing that within those clusters. So now we're containing it within an individual with quarantine, but soon we'll be working with clusters as well. So that's how this will progress. But once again, I have no doubt with the way we're working together as a community on this and with us being isolated, we do have an opportunity to really control this.